Hi everyone, it's Dr. Owen MacDonald here in Core Medical in Port Kennedy. It's the evening of the 15th March, and I just wanted to give you all an update on where we are in regards to the coronavirus situation. So, as you all know, it is a world problem that's getting worse day by day. Unfortunately, what we are seeing is just the tip of the iceberg. Um, as most of you probably know, but in case you don't, the symptoms are any flu like symptoms, so usually fever, shortness of breath, cough, sore throat. Um, the symptoms are often mild, but the problem is it is very contagious. And the main issue is that children are acting like carriers or suffering a very mild illness and will likely be linked to spread. However, the fatality rate in the older population is extremely high. Now, as you've probably seen, the problems in Italy, especially in northern Italy, are massive, and what we want to avoid is becoming like Italy. This was from Friday, the 13th, when there was 4,600 people worldwide. This is worldwide had died. As of Friday, there was over 1,000 people dead in Italy, and today, Sunday, that has risen to 1,400. So the main issue is, you can see here on the graph that as it spreads, it is 3 times more contagious than the flu. More and more people get infected and more people die. So here on this graph, you'll see that as you get older, as you get into your 50s and 60s, and then obviously much higher in the 70s and 80s, the fatality rate goes way above 10%. So up to almost 15% in the 80 and above age group. So for Perth, why are we worried? Well, Perth has approximately 1 million residents. Best estimates over the next few months is that 40 to 70% will catch coronavirus. 80% of us will probably be fine, so we'll have mild symptoms or flu-like symptoms. But about 20% of those infected will need hospitalization and 3% will need ICU. So the simple maths of this is that approximately 2,400 people in Perth will need ICU. So unfortunately, in Perth we have only about 120 ICU beds. So that's a big problem. Now, in prepared countries in the world, they have managed to keep the fatality rate low, whereas unprepared countries, you're getting about a 3 to 6% fatality rate. But the big problem is it's not just coronavirus. The issue is that if all our ICU beds are taken up with people with coronavirus, people who suffer other problems, which happens every day, like heart attacks, strokes, allergic reactions, problems in pregnancy, there will be no beds left for those people in ICU. So unfortunately, people may die. So we need to take this seriously, folks. Those who are most at risk are those with a low immune system, with multiple medical problems, those with weak lungs, and those over 70 years old. So the stats are that people who end up being in ICU and ventilated will remain that way for 3 to 6 weeks if they survive. So we really need to contain this problem. So what can you do? How can we slow the spread and survive? Please, 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 I can't reiterate this enough. Please, if you have any flu-like symptoms, sore throat, fever, shortness of breath, please stay at home and call us. We will be able to do a telephone consultation with you, so please stay at home if you're feeling unwell. Call your GP instead of attending your GP and advise family and friends to stay away. Wash your hands and take basic precautions to keep everything clean. Wash down surfaces, use hand sanitizer. Remain at home until you're safe, and if you're at high risk, consider calling us for a telehealth or phone consultation. The thing about testing, we, as of the 13th of March, GPs cannot test. If you need testing, it has to be done in one of the COVID clinics or fever clinics, as they're called. There's very strict criteria for testing. You need to have a fever or acute respiratory infection with or without fever, and you have to have proven international travel in the previous 14 days or proven close contact in the last 14 days with a confirmed case. So please be aware that we cannot test you for coronavirus. So what are we doing in Core Medical? Well, we have limited equipment. We are at the front line, and unfortunately at some stage we are going to get sick. The main thing you can do is, if you're unwell, please stay away and phone us. Please protect us so we can protect you. If we get sick, we can't help anybody. If too many of us get sick, too many doctors, unfortunately the practice will close down. So please, if you're unwell, stay at home, call us, and we will try and manage things over the phone. Book a phone consultation with us if you're unwell. And as I said, if all these measures fail and we lose too many staff, we may have to resort to phone or consultations or Skype only. So, but please, hopefully it won't resort to that. Follow us on Facebook, and we will keep you updated. Now, unfortunately, because of the demand and because of the change in circumstances, we are going to no longer accept new patients. We need to concentrate our resources on looking after our existing patients, especially the frail and elderly, and those with immunosuppression or cancer, etc. So we will no longer be accepting new patients. So from tomorrow or Tuesday, if you want or need a phone consultation to be eligible, you need to be over 70 or over 50 and be of Aboriginal or Torres Strait Islander descent, pregnant, be a parent of a child under 12 months old, or under treatment for a chronic health condition, or be immunocompromised. So chances are, if you have seen us in the last 12 months for any medication, for any chronic disease management plan, for any ongoing health issues, you probably have a chronic disease, so you will be eligible for a phone consultation. So please call us if you need to. And lastly, please consider others. I would recommend forming a local Facebook group based on your street or neighbourhood. Try and not to hoard. Try and share food or toilet rules within the limits of what you can. Obviously, try not to infect people. Please hand wash as much as possible, cough into your elbow, and please socially distance yourselves. Avoid attending groups or gatherings in public places. Work from home if you can, and keep children at home as much as possible. As I said, they are the healthy spreaders. But the most important thing is, please, if you're unwell, if you're feverish, short of breath, sore throat, please stay at home and call us. You'll also notice coming into the practice that we have changed the layout of our waiting room. We have put up a hazard tape on the floor to distance patients from our reception staff to keep them safe. We will try and limit the amount of people coming into our consultation rooms to one patient or a child and one parent. So please honour this and work with us to help keep everyone safe. Okay, please follow us on Facebook, social media, and please share these posts so that anyone seeing them can be informed. Okay, take care.